Hello, good morning. How are you? Today our topic is otitis media. Do you know what is otitis media? An infection of the air-filled space behind the eardrum, the middle ear. An ear infection is usually caused by bacteria or viruses. In otitis media, otitis means inflammation of ear and media mean middle. It means it is the inflammation of middle ear. What causes otitis media? Otitis media can be caused by bacteria or viruses. In classification of type of otitis media, there are three types: acute otitis media with effusion, and chronic otitis media. Acute otitis media. In acute otitis media, it is a acute inflammation and infection of middle ear mucosa caused by pyogenic bacterial organism which enter into the middle ear through eustachian tube. In acute otitis media is usually rapid onset and short duration. Acute otitis media is typically associated with fluid accumulation in the middle ear together with sign and symptom of ear infection. Etiology of otitis media: upper respiratory infection, pneumococcus species, Haemophilus influenza, Moraxilla species, and rhinovirus. Pathophysiology of otitis media: due to etiological factor, there is obstruction in eustachian tube which create negative pressure in the middle ear which cause serous otitis media. It further divided into two: acute otitis media and chronic otitis media. In acute otitis media, it causes acute mastoiditis, and in chronic otitis media, it causes cholesteatoma. Diagnostic evaluations are laboratory studies, imaging studies, audiometry, radiography, CT scan, and nasopharyngoscopy. Medical management of otitis media. Antibiotic help to prevent long-term otitis media. Example, amoxicillin. In assessment of pain and fever, antibiotic and analgesic may be prescribed. Surgical management. First is tympanocentesis. In this, insert needle into the tympanic membrane and aspirate the content of middle ear into the sterile trap for identification of microbes and their properties. And the second is meningotomy. In this procedure, in which a doctor creates a small hole in the eardrum so that fluids such as water, blood, pus can be drained out. Otitis media with effusion, also called serous. It is simply a collection of fluid that occur within the middle ear space as a result of negative pressure produced by the eustachian tube functions. Clinical manifestation: first is hearing difficulties, second is pain in the ear, third is fluid that drain from the ear, and fourth is feeling of fullness in the ear, fifth is pulling at one or both ears, sixth is loss of balance, and seventh is delayed speech development. Treatment of otitis media with effusion. First is antimicrobial agent should be given because of pathogenic bacteria, and the antibiotics, example amoxicillin and erythromycin, should be given. In surgical treatment, tympanostomy tube inserted into the middle ear to allow to pass through into the middle ear and release pressure and help clear excess fluid within. Tympanocentesis and meningotomy also used. Third type is chronic otitis media. Chronic suppurative otitis media, also known as chronic otitis media, is a stage of ear disease in which there is an ongoing chronic infection of the middle ear without an intact of tympanic membrane. This disease is a chronic inflammation of the middle ear and mastoid cavity. Pathophysiology of chronic otitis media. In this, due to etiological factor, trauma cause inflammation and obstruction of ear canal, which cause eustachian tube dysfunction, in which S. auricle enter the eustachian tube from the contamination secretion in the nasopharynx, which invade in the middle ear, which cause tympanic member perforation, in which abscesses formation occur, which cause destructions of ossicles and purulent exudate. In destruction of ossicles, it causes osteomyelitic erosion and mastoid ear cell erosion, which cause conductive hearing loss, and in purulent exudate, foul-smelling otorrhea occur. Treatment of chronic otitis media. The main form of treatment for chronic otitis media is antibiotics. Antibiotics are mainly ear drops which are usually prescribed. Clinical manifestation of chronic otitis media. First is hearing loss, fullness of ear, foul smelling, drainage, facial weakness, vertigo, fever, confusion or sleeping, tenderness of mastoid process. Diagnostic evaluation of chronic otitis media. First is laboratory studies, CT scan, MRI and audiogram. Medical management of chronic otitis media. First is antibiotics, which is typically and systematically applied. Antibiotics are used in the treatment, for example, ciprofloxacin. And second is oral toilet, typically applied so that preparation cannot penetrate in the affected tissue until these interposing materials are removed. And the third one is control of granulation tissues. In the granulation tissue can prevent topically applied antimicrobial agent from penetrating to the site of infection. And the treatment of underlying causes are proper attention should be paid to any abnormality of the nose, paranasal, sinus and nasopharynx, and if you found should be treated. Surgical treatments are meningioplasty, meningiotomy, tympanoplasty, ossiculoplasty, autolam, adenoidectomy and mastoidectomy. In meningioplasty, it is the operation specifically designed to close the tympanic membrane with the use of operation microscope. In meningiotomy, a small incision is made in the eardrum to allow fluid to drain and keep the eardrum from rupturing. In tympanoplasty, the purpose of tympanoplasty is to repair the perforated eardrum and sometimes the middle ear bones. In ossiculoplasty, it is the surgical reconstruction of the middle ear bone to restore the hearing. In autolam, it is the procedure involve a tiny hole in the eardrum with the help of laser. Adenoidectomy, it is the surgical procedure to remove the adenoids, which are small organs located in the back of the throat and behind the nose. In mastoidectomy, it involves incision, drainage, surgical repair of the mastoid process. Types of mastoidectomies are simple mastoidectomy, radical mastoidectomy, cortical mastoidectomy and modified mastoidectomy. In simple mastoidectomy, surgeon either make an incision behind the ear to assess the mastoid region and remove the infected ear cell by approaching through the ear. In radical mastoidectomy, involve eradication of all the disease from the middle ear and mastoid destructure into the single cavity. It also includes removing the entire tympanic membrane and the ossicles. In cortical mastoidectomy, it is also known as Suchwart operation. It consists of removal of outer wall of mastoid cortex. In the modified radical mastoidectomy differ from the radical mastoidectomy in that the ossicle and the tympanic membrane are preserved for the possible hearing reconstruction at the later stage.